Well, the doctor is in, and today some disturbing new details about the Zika virus we've been telling you about. It's already linked to brain damage in babies and perhaps paralysis in adults. Travel advisories are in place for pregnant women heading to certain Central and South American and Caribbean countries. And the World Health Organization says this virus will likely spread across the Americas, and the warnings continue to grow. Joining me now, Dr. Saul Himes, an infectious disease expert at Stony Brook University Hospital. Doctor, it's nice to have you with us. As we just started covering this story about a week ago, it really at first seemed geared towards pregnant women, but now it's a much wider net. Why?
Well, first off, Jenna, thanks for having me. This virus, obviously, we at Stony Brook Medicine and in infectious diseases have been following this pretty closely. The research so far suggests that it's definitely seems to be linked to microcephaly, to sort of birth defects in babies, and so that's thus the warning in pregnant women. It is, though, a virus like dengue virus, like some of the other mosquito-borne viruses in that family that can affect ordinary healthy people and cause an illness with a fever and muscle aches and other symptoms. And so, I think we're just sort of anticipating that those sorts of infections, those sorts of symptoms are going to be cropping up as the virus spreads.
And now the question about whether or not it can be spread human to human instead of just mosquito to human. What is the likelihood that that could also be the case?
Sure, it's a good question. There's been a couple of studies, just a couple of case reports that have suggested the possibility of human-to-human transmission and specifically sexual transmission. One from a man in Senegal in 2008 who seems to have transmitted it to his wife after he returned. Another from 2013 where they found it in semen from a man in the South Pacific who had it. Those are interesting, and definitely further work needs to be done. This family of viruses we know is almost universally transmitted by mosquitoes, and so we would really need to study as this outbreak spreads and as more patients have it to try to do more research to understand if it's transmitted person to person.
As we now understand it, as far as where the mosquitoes are, these mosquitoes that do carry this virus are in the southern part of the United States, and we're starting to watch for cases here in our country. Who's best positioned to find a vaccine, and how close are we to even getting one to try?
It's a great question. We are not very close. This is a virus that predominantly had been in Africa and not been really on the radar much of people in the United States outside of those in the WHO and CDC, who obviously track things internationally. I know there are some companies, that are working on vaccines and some organizations in South America, but even if they were to start now with a running start, it would probably be on the order of a few years to develop one.
Wow, that's really interesting, especially as, again, the momentum behind this and the warnings behind it seem to be growing by the day. So it's a story we're going to continue to watch. On the other end of the spectrum, on a completely different topic, we do have what seems to be some positive news for those with type 1 diabetes. And this is the type of diabetes that is not about your weight or what you're eating specifically. This is something that you possibly are born with or you develop, doctor. Apparently there's a new type of stem cell therapy that's showing perhaps that there could be a quote-unquote cure on the horizon for diabetes. Tell us about it.
Sure. So yeah, I've heard a little bit about this. I'll say this is certainly not my area of expertise in that I'm not an endocrinologist. But as a physician, trying to sort of follow these things, it does sound like there was a study recently in mice where they were able to get stem cells that were engineered to become islet cells, which are the cells in the pancreas that make insulin, to stay in those mice and produce insulin over a longish period of time. This is an animal study. Obviously, further work would need to be done in people to see if this work would hold for humans, but certainly anything that would lead to a potential cure for diabetes, certainly type 1 diabetes, which predominantly impacts kids when they first get sick with it, would be wonderful to have a cure. It
would be, certainly. And it's interesting that you mentioned that it was tested in mice, because if we go full circle back to our first topic, which is the Zika virus, one of the things that makes it difficult to find a cure is that it's very tough to have the testing necessary for vaccines. You actually need to test on monkeys, and there's a lot of questions, ethically about that. So interesting as it all comes full circle. Dr. Himes, great to have you on the program. Thank you so much.
Thanks for having me.